Hi, I'm Jared Carter with Carter Physiotherapy, and this is a short video to show you how to do a self-release, a self-treatment on some very often forgotten or unnoticed muscles. Now the psoas itself, which is one of our main hip flexors, is often forgotten as well, but it's much more recognized in the ones I'm going to be actually teaching you how to deal with. And these as a trio have a lot to do in many cases with when people have back tension or back issues. These different muscles in the front can have a part to do with either reacting to that problem and causing more tension and issues in the back, or they can actually be not reactive but actually be causative, be something that's part of the back pain that you're feeling, especially if you feel like you can't straighten up, if you've been sitting down for a long time and you kind of had pain as you sit up straight. Sometimes, people will just say, well, let's go ahead and hammer away at the hip flexors and the psoas, and they're not really paying attention to these two muscles. And what they are is the iliacus and the diaphragm. And so we'll talk about the iliacus first. The iliacus, it combines with the psoas to become the iliopsoas. So you have the psoas attaches to all the lumbar spine segments on the front side of the back and goes down into the hip. And the iliacus is basically on the inside. If you think of your pelvis like a bowl, it's lining the inside of that bowl on both sides. So it combines down with the psoas and then connects deep into the hip and is responsible for things like hip flexion and we won't get into that. There's a bunch of other things that it's involved in. But I want to show today just a quick self-release or kind of self-massage technique for the iliacus. And you might find that it's quite tender. There's a few things to keep in mind. We don't want you pushing in the wrong spots. And so if you find kind of those pointy bones in the front of your hips, or the front of the kind of pelvis, you don't want to be poking inside of those or down below those, because now you're in the inguinal canal, all right? And you've got your inguinal ligament there, you don't want to be there. So that bony point tells you, okay, I need to be right above that, right? So the iliacus, if I were to kind of dig into it myself, I need to lean down, and I'm pushing down and in to that inner side of the pelvic bone right there, okay? So if I'm sitting down, which makes it a little easier, so I'm gonna find that pointy bone in the front of my pelvis. I'm gonna go a little bit above that, and then I'm gonna sink down, kind of lean down to the side just to kind of create some slack so that my fingers can dip in. My fingers, what they're doing is they're going in, they're going kind of in, down, and then out, right? So in, down, and out, and I'm right there, then on that often tender kind of flat fan muscle right there on the inside of the pelvic bone. And when I kind of breathe into it, you may not have to do this, but what some people can do when they've kind of worked it for a while, or when a practitioner has helped them, they can kind of come up to sitting and then drop back into it, come up to sitting, all the while holding, kind of pinning that muscle down. So it's almost like what we call a mobilization with movement, soft tissue mobilization with movement, where we're pinning that tissue down and then moving such that it's kind of stretching underneath our hands, like that. Okay, let's briefly talk about the diaphragm as well. So again, a lot of times we have these tension, issues in the front that are affecting the back. And so when people are just working the psoas, and you can check out many of my videos on psoas release, which is very important, they often don't get into the diaphragm and the iliacus as well. So the diaphragm, you're basically going to get into it right underneath the rib cage. So you kind of curl your fingers underneath. Now on this side, on your right side, on your right side, you're kind of getting into, you have to kind of get in front of the liver. This is not something I suggest for everyone to try, but on the left side, you've got your stomach on that side, and it's a little easier to kind of get in front of that and get into the diaphragm. So I'm just showing you on the left side. So again, I'm just kind of sinking in to make some slack, and I'm hooking my fingers underneath the rib cage. Not pulling out, I'm just hooking them under there, and then contacting the inside of the rib cage. I will be on at that point the edge or margin of the diaphragm. And so I'm holding that, just doing some deep breathing, and then again sitting up fully. Deep breathing. You'll feel as you take a deep breath in, the diaphragm will push down into your fingers, and then out. And you can also, with both of those, add a little bit of torso rotation, like that. Holding the diaphragm against the rib cage from the inside out with some deep breaths and some rotations. So try that. If you're having back tension, try those techniques very carefully. You know, notice exactly where I was putting my hands. You're not pushing in the wrong spots. And you know, if that helps to decrease the tension in the back, I would also suggest looking at the psoas self-release videos that I have on my channel at Carter Physiotherapy. Thanks for tuning in. Hopefully this helps.